you guys? Welcome back to the next episode of the Student Speak series. In this episode, I am super stoked to get these three schools for you guys because these students are phenomenal students and these schools are phenomenal schools. Alright, three schools we're representing today. We got South College, Medical School of South Carolina, and Cal State University of Long Beach. Lego! Do you want to learn everything you need to know to get accepted into DPT school? If you're confused about exactly which prerequisites to take or where to focus your attention on the DPT application, then consider taking my course. This course will cover tips and strategies for each aspect of the DPT application, where you will be equipped to understand everything you need to know to get accepted into your dream school DPT program. And right now, you could get this course at a discount for a limited time. Click below for more details. What's up, you guys? My name is Dr. Justin Lee, physical therapist. Here you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. This video, Student Speak series, if you haven't seen all the rest of the episodes before, make sure you go and check them out. I'll put that in the description below. But man, this series is making so much impact for incoming DPT students who are thinking about which school they should go to and what is student life like. That's why I created these videos and this series. So these particular students, I am super proud of them because not only are they going to phenomenal DPT schools and doing such a great job academically, but also on the side and outside of their program and their academic abilities, they are participating in things that are not just student related, like entrepreneurship, podcasting, massage therapy, and so much more. So go definitely check them out. I'm going to link everything in the description below. Go and show them some love. Go and follow them, email them. They would love to answer all your questions. So we have three schools in this episode. The first one, we're going to start off in Knoxville, Tennessee, South College, where we have Dawnette representing that program. Next, we're going to head over to Charleston, South Carolina, where we have Medical University of South Carolina, where we have Kaipo representing that program. And lastly, we're heading over to Southern California. Let's go! That's where I'm from. Long Beach. We got Cal State University of Long Beach, where we have Jenna and Charleston, who are going to be representing that program. So let's get this started. Let's get this map out here. Alright, we're going to get this started in Knoxville, Tennessee. Dawnette, you're up.
Hi, and good morning, good afternoon, or good evening, depending on when you're watching this. My name is Dawnette Waters, and I'm a first-year physical therapy student at South College, which is in Knoxville, Tennessee. Now, before I get into talking about this amazing program, I just want to give a shout out to Justin and say thank you for this opportunity to talk about my program and to commend you for the work that you do and the free time that you use to put these videos together and to give this platform for prospective students. So shout out to you. So South College, the DPT program is a 2-year hybrid online program. Now, when people hear that one, it's 2 years, yes, it is an accelerated program. And then the hybrid online portion. So when people hear online, they automatically think that everything is done online, which is impossible because one of the very essential aspects of being a physical therapist is the hands-on aspect of being able to, touch the patients and being able to assess them properly with the exam. So when we do our online portions, that's mainly the didactic work with the lectures. And then when we meet for lab immersions in Knoxville every quarter, so we meet there every 2 to 2.5 months, that's when we do all the hands-on aspects. So when it comes to the lectures, we have both synchronous and asynchronous lectures. For the synchronous lectures, we meet at a certain time of day, 1 to 2 times a day. And that's Monday through Thursday. And during that time, during those lectures, we use our cameras and our microphones to be able to interact with our classmates and with the faculty. So if they were to ask us questions, we can interact in that manner. We can also use the chat bar. So it's very engaging, just like you would if you were in a typical classroom within a brick and mortar. So you're not really missing out on anything in that regard. When it comes to the asynchronous lectures, they are pre-recorded, and you have a number of videos that you have to watch for each course. So that's when your time management, your organization, and your motivation comes in, because with those videos being pre-recorded, you can watch them at any time, but you really want to make sure that you watch them in a timely manner. So when you do have your synchronous lectures, you can be caught up on the discussions, and you can be able to be very engaged in conversation in the classroom. So that's one of the things that appeals to some students, and then some that it doesn't, and that's okay, because not every program is meant for everybody. So that's how that works. Now, when it comes to the lab immersions, like I said, we meet every quarter. And depending on the quarter, we can be in Knoxville for anywhere from 4 days to 2.5 weeks. And the school will reserve rooms for us in a hotel, which is close to the lab facility. And then if you are like myself and other students, you might just get an Airbnb with some of your other classmates, and that saves us money as well. So because the program gives us the flexibility to be anywhere, a lot of us will either fly in or drive in. We're spread out everywhere. We have students that are in Alabama, Florida, California, Colorado. I'm in Georgia, and we even have a student that's in Alaska. So it's amazing how we can be spread out, and yet we still feel so close. And that's one of the things that I really love about when we do have the lab immersions, is that it's like a little mini reunion. And so even though we are working and we're learning, it's very fun being able to come together and to really to encourage one another in person. And then that's when we get the opportunity to do our lab practicals, our oral exams, and our skills checks. When it comes to our our exams, the exams are reserved every Friday. So you can have 1 to 2 exams every Friday, and the exams are proctored. So you will use your camera. You'll be have someone monitoring during that time that you're taking your exam. So again, just like if you were in a classroom, when it comes to our clinicals, we have 8-week inpatient clinical, and we'll actually be doing our first clinical this summer in July, so we're very excited about that. And then we have our final clinical in our second year, which is a 23-week clinical, and we have the opportunity to split that into 2, so we can do a 12-week and an 11-week clinical. Even though each cohort has about 100 students, so you may be concerned about if you would get a clinical for, the place that you would like to be. South College is affiliated with about over 1,000 facilities across the nation, so that shouldn't be a problem at all. And so far, we've been fortunate to be able to be in the place that we want to be, or what they believe would be more beneficial for us. So. And for me, I'm a wife, I'm a mother, and so it was important for me to be able to stay close to home, and I've been able to do that. So it's been working out great. Trying to think of some other things that I'm asked about frequently. So with it being a 2-year program, one of the things that we have the opportunity to do, and that the school encourages us to do, is an affiliation. So since we have that 3rd year, we can do an a residency and many students take advantage of that. They're affiliated with EIM, Evidence in Motion, and Evidence in Motion has a plethora of residencies that we can take advantage of. So that's one of the big perks about this program. It's non-traditional. The platform is very non-traditional. And that's one of the things that appealed to me, again, as a wife and as a mother, being able to have that flexibility with being able to do lectures at home or to travel and see other friends and family and still being able to be part of the classroom. So that's one of the huge perks of the program as well. The facility, or the faculty, is amazing. When I found out about who some of the faculty were, it was kind of mind-blowing for me, because I've either watched podcasts or listened to podcasts or watched various videos online that have these same professors that will be teaching us, and finding out that a lot of PT programs actually use some of the books that our professors have written, or they're just how high ranking they are in the profession, and the recognition that they have. It's one of those things that I definitely like to brag about. So if you have any other questions about the program, you can always contact me. You can find me on Instagram at Melodic Patients. You can find me on Facebook. You can look on the pre-PT grind, or you can look on the pre-Doctor of Physical Therapy page, first and last name, Dawnette Waters. And then you can also follow South College on Instagram, on Facebook, and Twitter, and you can find out a lot of information about the program there as well. So I hope I've answered your questions and any inquiries. Again, don't hesitate to contact me, and I wish you all luck on whatever program that you decide to apply to. Thank you. Bye.
Hey, so really quick, if you like what Dawnette had to say, please go message her. And if you're liking this video so far, give this a thumbs up. I also want to know which school in this series, if you've seen all of them before and you haven't had a school of your interest represented yet, make sure you comment below so I can hunt that student down and ask them to participate in this series. Okay, let's get this map back out. We're gonna head over more southeast. We're gonna head over to Charleston, South Carolina for the Medical University of South Carolina. Kaipo, you're up.
What's up, guys? My name is Kaipo Sotelo. I am a physical therapy student here at the Medical University of South Carolina. It is 70 degrees outside in December, which is pretty big, at least for a kid from Guam. But aside from weather, there's a bunch of great things about this program. The program itself is really well structured to me. We have also fantastic faculty and an amazing clinical experience. I'll talk about the program in general. We do about a year and a third of musculoskeletal and really foundational things like transfers and basic musculoskeletal disorder treatments. And we get sent on our first clinical, which is an 8-week clinical, getting in usually with the outpatient ortho. But I know some people have done home health and some on rare occasions have done inpatient. But yeah, then we come back, which actually just came back from my clinical up in Maryland. Amazing time. But a lot of things that we learn in school, we actually get to apply in clinic early on. And actually, our clinical is not usually the first time we interact with patients. We have a pro bono clinic called CARES. We meet on Tuesdays and Wednesdays. Tuesdays are muscular nights and Wednesdays are neuro nights. And we have a student-run board with faculty supervisors, but we get to see patients. I saw patients and treated within my first couple months of PT school, obviously under supervision, but being able to put my hands on patients and actually do what we got into school for that early on was really exciting for me. Yeah, we have a great opportunity with that kind of thing. And then faculty, I can't speak highly enough about our faculty. Our department head, our division head, Dr. Bowden, has really led a solid ship. And between our musculo practicum and our neuro practicums coming up for us here in the second year, we have amazing faculty that all have not only their DPT but their PhD and have won a lot of grants and are really working on pursuing PT for the future. It's actually really cool to interact with them. These people are really smart and they're helping us along. Actually, to talk about something that is rather, like, I guess unique. I took a year off of school. I got in with the class of 2020, but I took a year off of school to help out with some family things. And when I called Dr. Bowden, I was like, hey, I have to go home and take care of this. And he said, what do we got to do? And now, about a year, just over a year later, I'm back with this new class, and everything is integrating well. I had to put in extra work for sure, but so did the faculty, and I greatly appreciated that. Being able to have the opportunity to actually come back after the little sabbatical was really tough, but with the help of the faculty and obviously my new classmates and my old ones too, I was able to get reintegrated really well. So between the faculty, the program, and the clinical experience, of course, we have plenty of ways to get involved. As I mentioned, CARES, we have 4 clinicals, one at the end of at the end of our muscular block, and then we have 3 back-to-back on our third year, generally increasing in weeks spent. And that'll be your inpatient, that'll be your specialties and whatnot. But our faculty really wants you to be the best PT that you can get in during your curriculum here at MUSC, and you really get to take charge of what you get involved with. For example, my EBP paper was on BFR and space and its application in microgravity. The faculty generally knows what you want to do with PT, and they'll do their best to sort of get you along that way. But yeah, I think that's all that I got for MUSC. Huge advocate, highly recommend. If you have any questions, just let me know. Once again, I'm Kai Bosello, second year PT student at MUSC in South Carolina.
All right, 2 students down so far. Guys, if you're getting a ton of value from this video, please share this with somebody or someone who is trying to get into these schools that are in this episode or any of the other episodes that are in this series. All right, we're gonna go over cross country and we're gonna head over to Long Beach, California, where we will have represented Cal State University of Long Beach. Jenna, Charleston, finish us off.
Hi, I'm Jenna.
I'm Charleston.
And we're first-year students at California State University Long Beach's DPT program.
And I actually graduated from there for my undergrad, and I emphasized in kinesiology, exercise science.
For my undergrad, I actually went to San Diego State University, but I made my way up to Long Beach for DPT school. So speaking about Long Beach's program, one of the really great things about it is its location. So I would say it's pretty much halfway between LA and the OC, which is good if you plan to commute, or it's really great for the clinicals that we do in our third year because it's a pretty central location.
Mm-hmm. And with tuition, I think we pay around like $27,000 a year, as well. But in contrast to like other schools, it's about like $40,000.
Yeah. So we are a public university, and which is significantly cheaper than any private universities. Anyways, moving on, we have a pro bono neuro clinic on campus, which in our second year we will begin to treat patients in. So because we are in our first year, we haven't had any experience treating patients yet, but they do welcome first year students to come in and observe, which I have done and have really enjoyed.
Nice. And also in our third year, we're going to be in the ortho clinics. In my undergrad, that clinic was available to me as a PT aide. And so I worked at PT at the Beach, and I was really exposed to different type of clients like pediatrics, patients with Parkinson's. And so I was able to see that in that light and be able to treat and build rapport with these type of patients.
So the neuro clinic and the ortho clinic that we're talking about are free for community members, and the DPT students do treat patients in them as part of their coursework. So moving on, we do have a pretty small cohort. Our current cohort is only 35 students, and I think usually they cap out at around 40-ish or so. So they do try and keep it really small, which is really great because we get more of a one-on-one experience with our professors and smaller labs.
Yeah, and I think like when we first started, like a really big goal that they wanted to do is get all of our names down, and it was really nice. You know, it was just like the little things that they were trying to do in order to like make bonds with us. And but with it being such a small cohort, like it makes it a really big emphasis on their part to who will be, you know, accepted into the program. And so letters of rec and personal statements actually play a big role into the acceptance rates.
So another pro with Long Beach's program is the fact that we have a brand new acute care lab, which is really cool. It has 4 hospital beds with 4, what would you say, like dummy type patients. You can talk more about that.
So pretty much like they have like live patients pretty much in a mannequin setting. So these mannequins, they're able to like have a heart rate, a blood pressure, they have a ventilation system. They actually can talk, and the instructors can remotely have them, you know, cough or say things that real patients would say, you know. And with that, we actually have a dissection lab, which is our first year having that. I think.
Yeah, so it's our first year dissecting. Well, actually, it's the program's first year having their students actually dissect. So we were kind of the guinea pigs, and it was a really great experience. And from here on out, all of the cohorts at Long Beach will get hands-on experience dissecting with cadavers, which is really important when you're learning anatomy.
Yeah, because I know, like, you know, the 3D models they help a lot, but seeing the different variations between muscles and where they insert and originate makes it a really interesting aspect behind it.
Yeah. So another unique aspect of Long Beach's program is the fact that the program doesn't really have an emphasis on any certain setting at all. We have professors from ortho setting, neuro setting, peds, geriatrics, so we really are exposed to it all.
And actually, I think we were able to observe pediatrics in like the family care center in our location at Cal State Long Beach. And it was really interesting because I feel like being exposed to that at school, it was like it's really convenient.
I agree.
And so on top of the dissections lab being our first year and us being the first kind of guinea pigs for it, we actually have another course called Fundamentals, and so that is putting more emphasis on learning about goniometry, manual muscle testing, and transfers, which is apparently very important, which I've learned very much so. And I think they've implemented it because they are adapting.
Just to be clear, sorry, it's their first year. Like, we're the first cohort to have this fundamentals course.
Yeah, and so I think they did it because they wanted to adapt to better learn for the students, so they can be set up for success. Because what they've seen in other previous years, is like a lack in some sort. And so they're able to adapt their course load to, you know, what the students would need in order to succeed.
So moving on, another thing that's unique about our program is that it does require us to do research. So we will begin that in our second year and finish it up in our third year. And I think it's our second year because we haven't done this yet as first years, but next year we will be choosing which professors and which research projects we want to work on, and then working with them on those.
So with all these pros that we've talked about so far, there are always drawbacks to the program. And so, like we said before, the small cohort size of 35 is really good because it makes an intimate setting for the faculty and the students. But in order to get in there, it's a lot more competitive. I think this year alone for Cal State Long Beach, 1,600 applicants applied, and only like 0.02% of these applicants got into the program. And on top of that too,
So another drawback to kind of our program, well, just the school in general, Cal State Long Beach is a very big commuter school, and so parking can be kind of difficult. Luckily, most of our classes do start at 8 a.m., so we don't really have to deal with the parking, but it does get crowded, so that's just something to think about.
And one other con that we can think of is there's only like 3 rotations that are pretty much we're exposed to at the end of our 3rd year. And it's good because, you know, we're able to see these settings in such a long span, which is about like 12 weeks.
12 weeks, yeah.
But it makes it so that we have to really figure out and choose what 3 rotations and what 3 settings we would like to see. But I mean, like with the 12 weeks, we're able to make bonds with these CIs and see what their like hints, tips, and tricks would be with their clients. And we're able to see these patients for a longer period of time and build that rapport.
Yeah, so like on that point, we can, with the 12 weeks, we can really see the patients through like a full course of treatment, which is really cool. But it does kind of suck that we only get to try out 3 different settings.
And with that too, it's like I've heard from other programs, they are able to get rotations maybe in like their 2nd year, and so they can kind of implement and integrate their learning to the real life setting, whereas for us we have to get all our knowledge and then see how we can adapt it in the long run as we can, like, you know, transfer out into the real world from the program. But yeah, so that's our take on Cal State Long Beach, and I hope you guys learn a couple things from it, and see you here.
Thanks for watching. Bye.
Okay guys, thank you so much for watching this video. I hope this video helped inspire some self-change to look into some programs, or maybe I shouldn't apply to some of these programs. PT-CAS and the application cycle for physical therapy school is coming out. So if you're ready to apply and you haven't thought of any of these programs yet, please go check them out, apply. It's a couple more bucks, but hey, you might be surprised, you never know. You might end up meeting some of these students and they will definitely 100% take care of you when you come in as a DPT student. Alright y'all, thank you so much for watching. Once again, if you have any programs, DPT programs that you want represented that are not in the Student Speak series or in this episode, please comment below. And if you have someone who would want to watch this video, or you're like, hey, you should definitely watch this because you were talking about going to South College or Cal State Long Beach before, you should check this video out. Thank you guys for watching. Have a great one, you guys.